all of us to squeeze him out. But just to lighten the mood, Dr. CHOTALIYA, for all of you don't know him, he is known for his wit and humor, and he is going to be doing laughter and ophthalmology. And the king of that, Dr. Muscati, is sitting in the background. He's just seeing one of his juniors take his role. I think one of the best humor in Indian ophthalmology is the man sitting behind there.
And presence of mind.
And one of the most well-dressed men I've seen, Dr. Muscati.
Good morning, friends. First of all, I would like to thank Dr. Lalit Verma, President of this Congress, Dr. Namrata, Chairperson of AIOS, as well as my friend Kamal, who is my friend since almost 2 decades, and I share a couple of things in common with him, that the name of his son is Vyom, and the name of my grandson is also Vyom. And I will be sharing one slide also. Laughter, a cost-free, instant best medicine. My agenda, laughter as a whole, physiology, psychosomatology, types of laughter, benefits, medical humor, tips to develop humor, quotes about humor, summary. Disclaimer that no intention to defame anybody, no financial interest to be disclosed. Naming anybody is either coincidental or intentional selection just for the purpose of fun and not to hurt anyone. Laughter as a whole, components of laughter, it is a set of gestures, the audio effects our body performs as rhythmic, vocalized expiratory and involuntary action known as laughter. Study of humor or laughter and its psychological as well as physiological effects upon human body is called gilatology. Physiology of laughter, we can say that it stimulates heart, lungs and muscles, enhances intake of oxygen, sets off flow of stress hormones, which are increasing, suppressing this immune system, and which would have raised otherwise blood pressure. Laughter causes increased number of killer cells that destroy tumors and viruses. T cells increase gamma interferon, increase beta cells which make disease-destroying antibodies. There is a stimulation of zygomatic major muscles, lifting of upper lip in the laughter. Respiratory system is upset by epiglottis, up closing of the larynx and making us gasp. In extreme circumstances, tear ducts are activated, resulting into opening of the mouth and closing, and thereby struggle for oxygen intake continues, which causes face to become moist and red. Laughter provides a way for those emotions stored as negative emotions such as anger, which earlier Kamal has also told, sadness, fear, to be harmlessly released rather than expressing them. It is cathartic, keeps negative emotions away which are held inside and causing biochemical changes affecting our bodies. Laughter gives diaphragm, abdominal, respiratory, facial, leg as well as back muscles a workout. We feel exhausted after a long bout of laughter, just like we had an aerobic workout. Laughter causes hiccuping and coughing, resulting into cleaning of respiratory tract by dislodging the mucus plugs. It also increases concentration of salivary immunoglobulins, which defend against infectious organisms entering through the respiratory tract. These are various types of laughter. We will not go into detail, just there are etiquette just to show. It is as if I would call it to pretend as if we are laughing. So there are many other, this contagious, nervous, belly, silent, pigeon laughing, snoring, cruel, and all these things. Benefits of laughter, as we have already discussed, that facts about laughter. The average child laughs about 150 times a day. The average adult laughs only 15 times a day. Exposure to laughter is shown to reduce stress, as we have already discussed. Humor has shown to enhance group problem solving. Babies start to chuckle when they are as young as 29 days. 100 laughs equal to 10 minutes of aerobic exercise. Laughter releases the tension around even the heaviest of matters. The best part of laughter is that it is contagious. Humor between married couples contribute to marital satisfaction. Laughter is a sunshine in a house and most civilized music in the world. We do not laugh because we are happy, but we are happy because we laugh. That is why somebody is right that you don't stop laughing because you grow old. You grow old because you stop laughing. Take the instant vacation that laughter is as often as possible, and you will start finding life more meaningful and the world a better place to live. We have already discussed this thing. I will not go into detail. Now, medical humor. These are my own created. In emergency, laparotomy was being performed of a patient with acute intestinal obstruction after swallowing a fish. After an exhausting surgery of 2 hours, the surgeon came out of OT and told to the relatives of the patient, "You are lucky as the patient has swallowed a fish with precious pulse, which will enable you people to pay my fees as well as his antim kriya." And nowadays, as you know, there are various corporate hospitals are there. So an unconscious patient was brought in an emergency ward. A cheat was found from his pocket mentioning that my appendix has been removed thrice. I am an epileptic patient. I was traveling to Ahmedabad with my other ophthalmologist colleagues to attend Gujarat State Conference. I was sitting beside the driver of the Innova. We were discussing about various topics, sports, politics, movies, etc. I was one of the active participants in the discussion. When we crossed Limdi, the topic was changed and my other friends started talking about LASIK, femtosecond, flying sport, etc. and whatnot. I remained silent during this discussion. When we got down at Ahmedabad, the driver came to me and said, "All these guys seem to be ophthalmologists. What about you?" Long back, before 3 decades, one of my friends came to see me at my home. My elder daughter was playing in the corridor. My friend asked her, "Betty, is your daddy there?" She told, "No, he has gone for IOL surgery." My friend was surprised to hear these words from her. He asked her, "Do you know about IOL surgery?" "Of course." She told, "It means 5,000 bucks. One day I was changing the post-operative dressing of an elderly debilitated patient. I told the patient that be careful, get down slowly from the table as orthopedic surgeons are quite costlier. Immediately the patient's son utters, "I know, sir, that you are a very close friend of Dr. Lakhani, who is the orthopedic surgeon, Junagadh, and very close friend of mine, and he is supposed to be quite costliest. As I have been doing up-down since 27 years between Junagadh and Jaipur."
Dr. Chotalia, we need to roll up. Dr. Muscati is very patiently looking at all of us.
Most of my patients at Jaipur are not known to my family. So I was moving in a mall at Rajkot with my wife. One beautiful lady glanced at me with a broad smile. I reciprocated her with a great smile. My wife was annoyed to see. She said, "Who is she?" I explained her that we know each other professionally. She said me, "Tirchi Najar se, by whose profession, yours or her?" One gentleman met with an accident near railway station and he had been to my same friend and he was very much worried. So he asked, "Doctor, would I be all right as before?" My friend told that, "I am not sure about that, but you will be able to walk just now." Patient said, "Wow, how is it?" My friend told that, "I will acquire your car as my fees." An ENT surgeon and a gynecologist were having their clinics nearby due to heavy marriage season. The gynecologist had to attend a marriage, so he requested the ENT neighbor to run his OPD for few hours. The ENT surgeon was examining a lady by putting sim speculum, and he asked the lady to say, this is the, I think, the same slide. Patient may come like that, modern patient. And int ka jawab pathar se denge. So modern doctor will be like this, that patient will be charged extra for enabling the doctor with any self-diagnosis gotten from the internet. This is also a kind of this modern technology. This is about anesthetists, and I will not go say. Now in the era of AI, this thing may also happen, that sonographically it will say that, let me guess, these twins were conceived during Navratri. I operated one lady with 9 daughters. I informed
Dr. Chotalia, I have got a thing for them to shut it off.
Okay. So figure out what makes you laugh and do it or read it or watch it more often. Surround yourself with funny people. Develop your own sense of humor. Be funny every chance you get, as long as it is not some of else expenses. Summary: never think hard about the past, it brings tears. Don't think more about the future, it brings fear. Think more about plenty of humorous moments and live present, then no tears, no fears, and have must life, which brings cheers. Thanks a lot for patient hearing, as well as I would like to tell one thing, that in our Gujarati, it is said that if I have hurt anybody, please kindly apologize me. In spite of that, if you still feel hurt, thaya kari lejo, meaning by that you can do whatever you want to do. Thank you.